Welcome to the Pain-Free Athlete Podcast. I'm your host, Dana Jones. I am a certified personal trainer, and I'm here to help you achieve your fitness goals without pain. In each episode, I'll share tips and strategies that will help you stay safe and pain-free while you're working out. I'll also interview experts in the field of fitness and pain management. So if you're ready to learn how to stay active and pain-free, then subscribe to the Pain-Free Athlete Podcast today. Hi, everyone, and welcome to the Pain-Free Athlete Podcast. I'm your host, Dana Jones, and today I am joined by Dr. Zameer Pirani. Today's guest, he is a medical director and founder of Afiya Spine and Pain Institute. Since opening his first clinic in Toronto in 2023, Dr. Pirani has grown his team to 13 physicians serving over 5,000 patients and recently expanded to Hamilton to address Canada's growing need for chronic pain care, where 1 in 5 adults suffers from chronic pain. As an anesthesiologist with the Scarborough Health Network and a leader in sports medicine, Dr. Pirani is dedicated to transforming pain management and reducing wait times for those in need. Dr. Pirani, welcome to the show.
Thank you for having me, and thank you for the warm introduction.
I just, got to get all the angles because I've been working the show talking to people who are recovering from chronic pain and different practitioners, and you're kind of my first anesthesiologist and sports medicine person, so I appreciate that.
Thank you for having me. I hope I can give some insight to some of your listeners.
I hope so too. So what inspired you to specialize in pain management and your procedures, the interventional procedures?
Yeah, so pain management wasn't really on my radar when I first started medical school and even residency. I thought I wanted to be an intensive care physician. But when I got into anesthesia residency in a city called London, Ontario, it's about 2 hours outside of Toronto. Part of our core rotations is in chronic pain. So it's a mandatory rotation. And when I was there, I saw how complex the needs of patients were. So you're looking at patients who have job losses, mental health issues, relationship troubles. It was more than just chronic pain. And I'm through the era, and we're still in the era of opioid misuse, right? And so there's a number of Netflix documentaries. It's very, very, very common knowledge to the public about the opioid pandemic. And that's further being highlighted post-COVID, the COVID-19 pandemic that we just had. And so I was seeing patients on massive amounts of opioids. I was seeing a lot of addiction. And then I was also seeing patients who just needed their acute pain was becoming chronic because of the wait times that we had in Canada. So I thought to myself, where are these patients going to go? Why do we have a 2-year waiting list to see a specialist for chronic pain in our province? And I felt the need and I felt the desire and the passion to look more into it and find ways to bridge solutions to get good quality care for patients.
2 years is a very long time to wait to see. Is that because of the nature of the system or?
So, I mean, I think it's a two-prong effect. So, we have a social healthcare system where everyone has insurance. It's dictated by the province, not by the country of Canada. So every province has their own healthcare funding model, but it's a social where everyone gets equity in healthcare. And I think that's a very good system. So, there are other pain clinics out there. However, they're not specialist led in terms of, they're not anesthesiologists with additional training in pain or rehabilitation physicians with additional training in pain. A lot of them are primary care physicians who have additional training in pain medicine. So, patients who really need, for example, image guided procedures, they need the whole holistic approach to pain medicine, that really falls through the cracks. And there's only a select amount of places where you can get that in the province where I work in Ontario, which is the most populated place in Canada. So, that was a large issue. So a lot of patients were just going to these community pain clinics. There's different quality of care in all of them. And I can't speak on all of their behalf, but, to get the image guided, to get this specialist led where the physicians actually have a much larger breadth of knowledge is problematic in our province.
Yeah. Well, it's problematic here. I know that a lot of my own personal kind of I don't know, like the medicine I received there was a crossing over because my primary care physician was like prescribing, and then I had other people prescribing medications and they weren't really communicating.
And that's a big problem here too,
Yeah.
right? So you get patients into the polypharmacy because pain is so frustrating. It frustrates the heck out of you. And patients, you can't blame them. They're looking for solutions, right? And so that's where we kind of have to dictate care and actually improve ourselves, because patients do better when they're under one umbrella as opposed to being under 10 umbrellas, right?
Yes.
It's just common sense to me, right? So I think access is a big problem. So, I think if we were to summarize it, is just having access to these places, right? So,
So a person comes into your clinic and they say, I have back pain, right? I don't know what back pain is in Canada, but in the United States, it's our number one thing. So how do you decide what's the best treatment for them? What does the intake procedure look like?
yeah, so this comes down to the comprehensive pain consult. And by the way, so back pain's most common cost of years lost to disability and lost to your job commitment in Canada. So I think it aligns with the American statistics as well. It's a big problem, and it costs society a lot of money in terms of not only the patient but also the general population and society. But I always say this: your pain is real. I believe you. Not one glove fits all, right? So you have to do a comprehensive pain consult, right? And a comprehensive pain consult includes, a comprehensive history. And that history includes, what happened, was there any inciting injury, etc. But was there any kind of trauma in your life, a mental health history, any, family conflict or any conflicts in your life, your medications, what you've done before, have you done any conservative measures, right? Because a lot of the time what we see, the majority, not all, but in the majority, a lot of patients develop back pain because of age, because of, you know, weight and lifestyle. They can develop an acute injury that they don't manage properly with the conservative measures. That's including physiotherapy, acupuncture, rehabilitation. And then that can spiral off into becoming more chronic pain. And chronic pain is much more difficult to treat, right? And so I always say back pain comes from five places. Okay. If it's going to be pathological, it's coming from five places. It's going to come from your tissues and your skin. It's going to come from, ligaments. It's going to come from your joints. It's going to come from your disc, or it's going to come from your nerves. And then there's other causes like cancer and things like that that we need to rule out. But really, it's really important to do a comprehensive pain consult, and then to really harp on, to find out where that pain's coming from and really treat it holistically with all the different aspects of pain management. And I say, we need to get you moving. So I always say the four P's. So physiotherapy and rehabilitation, pharmacology, making sure your mental health is good. And then lastly, doing image guided interventions to actually find the place and the pathology where the pain is coming from in the back. And then lastly, I've, recently added, as I've evolved as a physician, and seen many, many, many patients, the lifestyle component. And that's like a big new thing in the literature that I think is getting a lot of spotlight. And I think that's certainly should be the case.
Yeah, and that's great because we are seeing that is that people, I mean, we do it with a lot of things, right? Especially if you're a chronic pain sufferers, that you want the drug because you just want it to go away. And a lot of times there's not that supportive change that happens, either nutritionally or through going to a mental health professional to work on some of the stuff. Because I noticed as I've been doing this work and I'm seeing like the trends of things. I remember as a kid, my mother had ulcers, and ulcers were a big thing in the 80s. And then now it's, then it was like migraines became a thing like 90s and whatever. And now it's back pain. And
Mhm.
as a society, we seem to evolve into these chronic pain conditions. And ultimately, I think the core of it is the stress and our stress response. And
Yeah.
because you could have those abnormalities, right? I could have degenerative disc disease. And if I'm doing all the stuff, then it may not affect me as deeply as if I have a bunch of stuff in my familial background that I haven't dealt with, and I'm angry and frustrated, I hate my job or whatever, then my pain level is going to be a 10, where somebody else with the same profile may only have their pain level at a 2.
And so that's also part of the comprehensive pain consult, just to go back to that, right? And that we
Mhm.
have red flags, we have yellow flags, we have, different types of flags, and those are taken into consideration. So unhappiness with your job, you're not a very resilient person, you have interfamily conflicts, you have a history of abuse, all these things combined together. And, I think a really important thing that I think the public and patients and everyone should know is that social isolation is a negative determinant for health, right? So if someone is socially isolated, they don't, necessarily have the education or the financial means to go see the right people, that can negatively impact their health. If they don't have any loved ones around them to kind of encourage them, that can affect their biopsychosocial state, right? And all these things make it difficult to treat chronic pain. Just because, a big thing in the literature is fibromyalgia. A lot of people have been labeled with fibromyalgia. And I don't like to talk about fibromyalgia. I say, you have widespread complex pain. I never put it because it's giving that patient the ability to say, I have a disability and now I have this disability for the rest of my life. We really need to empower patients. We really need to engage them in all the aspects of holistic care and really encourage them to move, because when people get into a chronic pain state, their depression gets worse, everything gets amplified, right? Their pain sensors, their brain is going crazy all the time, right? And if you give them an opportunity to say, like, I'm disabled and I have a reason to be disabled, I think that negatively impacts them. So part of being a great physician and a great healthcare provider, whether you're allied health, physiotherapist, is really to encourage your patients. I always say to them, pain doesn't always equal harm and motion is lotion. That's so, so true. I say that to my mother, right? I say, like when we go for a walk, I'm like, okay, let's just do an extra 10, 20 meters today and see how you feel, right? And I think that's we always keep sight of that.
Yeah. So if I were to start, what is a simple thing that I can start with in terms of, I guess, probably creating this atmosphere of safety?
Yeah,
What is a basic way that somebody can start moving, since motion is lotion, and
yeah.
also reinforce that?
Yeah, so I mean, it all depends. I mean, every patient is different, right? So, and I think that comes down to the comprehensive pain consult data, where you see them, you get a sense of their resilience, you get a sense of their motivation, and you also really need to know, where their back pain is coming from. So, as we get older, we know that your back pain, if it's mechanical back pain, meaning coming from your axial spine, it's most likely coming from your facets or your SI joints, or maybe a combination of both, a combination of both. And so we can do like directed healthcare, directed physiotherapy and exercise programs for them, where we know doing extension based exercises, building your core strength, right, make a magnitude of difference, and they help support your back. Where we can't beat time, and arthritis is part of getting older. And so I always tell my patients is like, pace yourself every single day, add another, or sorry, every single week, add a little bit more. If you feel like you need it's too much, then regress. But set goals for yourself and set realistic goals for yourself, and then change the way you exercise. So you don't need to deadlift 500 pounds as you get older, right? You can, I always say the best exercises as you get older are swimming and stationary bike, especially for the arthritic conditions, right? Because they offload your joints, they offload your back. They being in water, it's low pressure on your joints, but you still get resistance training, right? So those are the kind of the things that you can do to like motivate them, a little bit at a time, pace yourself, choose the right exercises. And a lot of people that I've met in my career were excellent, extremely, like running, doing all these things, and then they find that they can't do it anymore, and then they become hard on themselves,
Yes.
and then they stay at home, and then they isolate, and then because they can't run 10 miles anymore, they're like, okay, what do I do now, right? So that's a big part of it.
Right. Well, you gotta pivot, and that's part of the resiliency. But a lot of
Yeah,
times we just don't have that information, and there's a mourning period
yeah,
of I'm no longer able to run 10 miles. And I
exactly.
think people have to process that. So with support, like what type of mind body techniques do you integrate into your practice to kind of help people like deal with their transition into a new being, or no longer the marathoner or whatever it may be?
Yeah. So, part of my clinic, and I'm very passionate about this, right? We're a socialist healthcare system where the government funds, physicians to do their work. And, we always have to find, and I work out of an out of hospital environment. So how do I get funding to give patients who are vulnerable to, get all these important things like physiotherapy, rehab, mindfulness, the mind body things that I think have the best evidence. And we are really lucky that we have an excellent primary care physician who's put together um, uh, pain classes. They're There are support classes where you have up to 10 patients. They come from all over and they sit down together. They get the support system from the paying classes. But the things that we really harp on, and I don't know the whole curriculum, but I do know that, the large component of it is CBT, so cognitive behavioral therapy, mindfulness, meditation, and all these things, what they do is that they essentially calm the brain down, right? So they help build resilience, they help build perseverance. But what I always tell my patients, you have to do this because your brain is firing at 50 million miles per hour. And everything I do, whether I give you a medication or whether I engage you in these mind body practices, you're calming your nervous system down. And when you have a calm nervous system down, your life can just, your pain scores can go down, your function can improve, right? And there's level one evidence for this stuff. I was presenting to a bunch of orthopedic surgeons at a dinner about some of the interventions that we do. And one of my slides was, we looked at patients who had chronic back pain for 2 years. And this was a study done in the United States. Chronic back pain for 2 years. Hadn't done much in terms of conservative measurement. Middle-aged people, the typical age where you see chronic back pain. So axial back pain, 45 to 50-year-olds. They looked at MRI studies of these patients. They put it, one limb was put in CBT and mind body practices, and other was just given injections. And the pain signals after an 8-week very intense program in the patients who got the cognitive behavioral therapy, their pain signals improved. So they weren't as sensitive to pain. And so an MRI showed in the brain this pain signal pathway. And I thought that's just outstanding, right? And so when we know that patients, we can calm their nervous system down, I know that if I was to do an SI joint injection or a radio frequency ablation for their back, they'll even do better. And so maybe the physiology says, your nerves will grow back in 8 months to 9 months. But if you have all these other things that you've equipped yourself, you can even get a better result. And that's pretty profound.
Yeah, and I believe you're referring to the Boulder back study? Yeah. So, yeah, that's been, I think, life-changing for a lot of people to have that information, whether the medical community, especially in the United States, takes it on. I think they're slowly starting to change, so that's a good thing.
Yeah.
But it's still they're not really grabbing it as much as we
Well, I
would
mean, it's
like.
up to me and you, right? To
Yeah.
like actually just create awareness and promote awareness and be with healthcare professionals who believe in this stuff, right? Because seeing is believing. And you can say that to your patient. You can say, look, you are going to, when you see changes, when you see 5 to 10% increments in your changes, when you work with me and you see a difference, it's going to impact everyone around you, not just you, but the people around you, because you're touching that person's life. And then in turn, that person is touching other lives because all the other things that, all the people around them that love them, I think their lives get a little bit easier. They see hope, they see the change in the person, and that creates a lot of happiness, right? And a way forward.
Yeah, and we are not making our families miserable from just
Exactly.
being, well, and just sad too, right? Because if my back hurts, then I can't go out to dinner with everybody or something like that. And so then that reinforces that social isolation, right? Is that everybody else is
Yeah.
having fun except for me. And that's never good for healing. So people age and there's things that we have to worry about. You were just talking about your mom and taking her out for walks and how do we get people to move safely, and what are the different types of things that could possibly, like, what are treatments that you offer to help support them in moving safely?
Yeah, so I think that, the biggest part of my practice now, I treat pain from head to toe. And, back pain, neck pain, very, very common. Usually it comes from joints. And then our big joints, right? So our hips and our knees and our shoulders, we get rotator cuff pathology from overuse. Our knees, they just give out, right? These are, and I always say to patients, I would say, remember how you were in your 30s and 40s and even in your 50s, you had that bounce in your step and that bounce is gone? Well, that's arthritis, right? Arthritis is taking over your joint, and that fluid, that synovial fluid that we naturally produce, the ability for our bodies to produce that becomes less, right? Women, another joy of being a woman is the postmenopausal state. They lose the good hormones that keep the muscles and support their ligaments that allow them to support their lower back. So we see them getting a lot of women as they get older, they get sacroiliac pain and facet pain, right? Because their muscle bulk gets less, right? And that's part of aging. So really, we want patients to do weight bearing exercises but how can you do weight bearing exercises if you're in so much pain? So it goes back to the 4 Ps, right? It goes back to the pharmacology, the psychology, putting them on the right medication. So an example that I always see is that, okay, you have knee pain. Why are you on a pain medication that treats nerves? You should be on something that is an anti-inflammatory or kind of something that complements an anti-inflammatory. So that's part of the comprehensive pain consult. Really, really motivating them to do the right exercise. So I always talk about swimming and a stationary bike, right? Those are really great things for when we're in our 50s, 60s and we want to keep moving. Maybe running a marathon is not the best thing, but I know people love running, and I would never prevent them from that. There's the runner's high. I'm not a runner. Running never got to me. It
Nope.
hurts. It hurts my joints, right? So I get these people have. I get a lot of people like the runners have the runners high, and that's amazing. And I have a few marathon runners in my practice who are in their 60s and 70s. And then it's the right medication. So that's traditional pharmacological medication, but also diet, right? And so what's a good diet? And there's so many things out there. You can walk into a supplement store and they could sell you this, 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 and this, but what does the evidence really show? And so I like to keep it simple with patients, because if you add so much to their plate, then they ask me, all these things. And I think we'll talk about some of these other more fancy things that are happening in society now. Some are good, some are bad, but an anti-inflammatory diet. So it's quite common sense. Greens, lots of vegetables, right? Staying away from fried and fatty foods, all the things. Like, don't eat at McDonald's every single day, right? Because that can cause inflammation in your cells in your body, right? And so we know, and I'm not a nutritionist, but we know what healthy food is, right? People know what healthy food is. They know that they have to stay away from fried food. Red meats have shown to have been associated with cancer risks and inflammation. White meat and white fish are good, right? And then, all the other supplements. So like ginger, turmeric. So I really harp on the ginger and turmeric, because I think, there's really good evidence for decreasing inflammation, like on a cellular level with these two things. It's not just hocus pocus. And for me, when I have a lot of arthritic patients, we can look at everything and all these oils and potions, but chondroitin and glucosamine, they have the best evidence in the literature. And you can get a combo tablet. I say to my patients, take it with your coffee in the morning. It's one pill, right? And I've added it to my diet now. I'm going into my next decade. So, you don't think it's adding, but it's about that additive effect with everything you're doing. And then there's all these, interesting things. People want to avoid getting older. Some people take it on the chin, and they want to age gracefully and they're okay with aging. And some people want to try to reverse that, and that's okay, right? So, for pain procedures, typically the big things out there, and I actually did this today on a few patients. So hyaluronic acid and PRP. And another thing is stem cells. So hyaluronic acid, I really believe in, one, because there's good evidence for it. So hyaluronic acid, remember I talked about the joints losing their lubrication and their bounciness?
Yes.
Well, insurance companies in Canada, so extended health insurance companies, they cover it because there's level 1 evidence. A single injection under image guidance into your knee, into your hip, into your shoulder, into a synovial joint, a joint that produces fluid, can be helpful. Hyaluronic acid is a naturally occurring protein in our body that allows us to lubricate, creates moisture, causes lubrication to joints. And essentially what we're doing is, we're taking that exogenous fluid and we're putting it back into the joint. So the joint gets that lubrication, that bounciness. It also can, if there's cartilage, can help regenerate the cartilage, right? And so I find that, patients like things that they have insurance coverage for. So why not? Right? Right? So it's better than just giving corticosteroid, which I think is a band-aid solution and should be part of the diagnostic therapeutic considerations. But beyond that, we want to regenerate joints. We want to have people avoid potentially a knee replacement, right? So if they doing all these things, they're all additive, they're all synergistic. They work together like a synchrony, right? And then PRP, right? So PRP is big in the literature. I've used PRP myself. People are using it for cosmetic purposes, right? But from
What
a
is it?
pain perspective, platelet-rich plasma,
Okay.
right? So
So
that's basically
that's
your
where you're using their own blood.
yeah,
And yeah,
exactly.
okay.
And you're removing the good platelets, because the platelets are good proteins, right? So they're rich in growth factors and cytokines, which are just a fancy word for saying like great proteins, like these regenerative proteins. These regenerative proteins, allow our cartilage and our tissue to heal in its natural environment, right? And so, they have anti-inflammatory effects. They stimulate cells, the good cells that we want. They reduce pain, and people are putting it everywhere. right? It's all over the news. It's all over the media. You turn on your Instagram or your TikTok and everyone's talking about PRP. And so part of my job is to say, like, what does the evidence show? And even if something is off label or there's no good evidence for it, if you want it, and I think as your physician, I think it may help you, I don't want to harm you. But if it doesn't work, that's another consideration, right? So
Mhm.
where is the good evidence for PRP? So I always say the exact same thing to patients. I say, and they have to pay privately for it. The government doesn't pay for it
Okay,
because
that's
the
yeah, I was
evidence
gonna
is
say.
is scant, right?
Yes.
It's all over the place. But for knee arthritis, very good evidence. For labral tears in your shoulders and your hips, very good evidence. For Achilles tendinosis, so the runners, right? So I have a very, very elite marathon runner in my practice. And, I did 2 rounds of PRP and he's running. He sent me a picture of his medal. By the way, my tennis coach actually just messaged me today. He's in his 40s, meniscal injury
Mhm.
from all the twisting his whole life. He's ranked number one for the 40 plus tennis players in our province. And, I just did some treatments on him. So I treated him with hyaluronic acid and I'm going to do a PRP treatment to his knee to keep that knee stable, keep the regenerative, keep the tissues to create, that pro-inflammatory response and to help regenerate his tissues. That was a nice message I got today. So yeah, so, we really need to speak to a good professional who's going to have advocate for the patient and tell them the evidence. But we have Dr. Google, we have social media, we can find different reasons to do different things, right?
Well, and I was gonna ask you, how do you help patients learn about their choices? And because
Yeah,
there's so much information, and I think Doctor Google has been replaced by Doctor TikTok.
yeah,
I got in trouble by somebody. They're like, "You're telling me my pain's not real." And I was like, "Dude, why are you getting advice from TikTok?" And then somebody's like,
yeah,
"Of course they are."
yeah.
So I didn't realize that how many people were getting advice from stuff. But so how do you help educate your patients so that they could filter out because I may obviously Google with we have access now to studies, which
Yeah.
you are the only one who had access, but now I can look up studies and read the studies if I want to pay and look at the results. So how do you help people filter out the bad info?
Yeah, so that's a really great question, right? And so I think that you being an advocate and being an expert, it's our job to filter out the good research from the bad research, the good information from the bad information. And trust me, it's like a full-time job now, right? Like,
I bet.
and I'm happy that patients are empowering themselves. Back in the day, maybe not in my time, but back in the olden days, they were just like they just trust their doctor, right?
Yes.
And so people are more educated. We live in a globalized society. You could be on a trip somewhere in Europe or somewhere, in another state and talk to someone and be like, this worked really, really well for me. Right.
Mhm.
And so really giving them the science, well, this is how it works. Like, especially with my PRP discussions, I'm a believer in PRP in the right conditions for the right patients. I'm not going to inject PRP into an 85-year-old lady. What's the point, right? You're just charging them a lot of the money and it's not going to help them. I don't care what the indication is, right?
Okay.
You want to really have good patient selection, right? You want to have patients that have realistic expectations, right? And that's part of like that one glove doesn't fit all. So you can share the science. What does the science say? What does the evidence say where there's good evidence? Where is the not so good evidence? Where do you think PRP will be beneficial for you? Right? So that's part of my discussion with them. And patients have autonomy, right? So like it's elective things I'm doing. I can suggest something, I can recommend something, I can recommend against something, but the patient has the right to go somewhere else and get it, right?
Yeah.
And we see that all the time, right? Being confident, staying on top of the literature, advocating for your patients, I think is really, really paramount for giving them the best outcomes, right?
Well,
And
and you're
we're
you're in a special situation because you have a private clinic, so you do have the ability to sit and actually talk with people. And I think a lot of times for most of us, if we go in someplace, we're having a short visit and may not have the ideal condition for having a back and forth conversation and really digging deep into what may be causing my issue or how to resolve it.
Yeah, I mean, that's why I love pain. It's just so complex. I love pain. I love seeing the change in people when you help them with their pain. I love seeing the change in the people around them that happens when you treat their pain.
Mhm.
But pain is complex. People's pain is real, even though you can't see it, it's real. And so you build that rapport, you build that trust. between your patient and yourself, and I think it makes a big difference. But some you can't win with everyone,
No,
right?
not
And
at all.
all you can do is do your best, and that you can extrapolate that to life, right? So
That's true. Well, this has been a lovely conversation. So how do we get in touch with you if somebody wants to get more information or learn more about what you do?
yeah, so my pain clinic. So we have two in Ontario. It's Afiya Spine and Pain Institute. There's a website. I'm just getting it. It's called the AfiyaPainClinic.ca. So AFIYA painclinic.ca. And we do have an email on there as well, where patients can contact us on the contact sheet. I also do a lot of advocacy on our Instagram as well. So that's the Afiya Pain Clinic, or Afiya. If you look that up in Instagram, I'm sure they can find, and they can contact me. And I love talking to people. I have patients that come from out of province and out of country now. So that's just maybe speaks for some of the work we're doing. But we're really passionate. All the physicians that we've attracted are really passionate about really crushing and solving the pain, the complex puzzle of pain.
Well, Dr. Pirani, thank you so much for your time. I appreciate it, and keep up the good work.
Thanks for having me, Dana. Bye.